Greetings, professors, colleagues, as well as my chair advisor. Thank you so much for your support throughout this whole project. It's a very long project, very intensive, lots of sleepless nights. I'm sure my colleagues feel the same way. A lot of work has been put into this project, and I just want to say thank you for your supports throughout this whole um, long project. And today I'm presenting to you um, the project that I'm working on, which is improving hypertension within the primary care setting with MAP protocol. The purpose of this project was to research and propose a practice that improved hypertension management among adults within the primary care clinic. And in particular, the project aimed to address the question, which is to what degree does the implementation of MAP protocol as a standard hypertension management impact control rates when compared to the traditional office-based management among the patients in the clinic over 8 to 10 weeks. So um, that's my purpose. And just a bit of background. As we all know, hypertension affects millions of Americans. It leads to complications such as cardiovascular disease, which is a major cause of death in our country. Roughly about 10 million uh, deaths yearly, and it affects about 1.3 billion people in 2020. So obviously, this is an urgent need to design and implement a more effective intervention to manage hypertension, more standardized, we put it that way, to also improve the quality of care for patients suffering from hypertension. Considering the potential outcome is another purpose of this study. The primary health care needs to strengthen its advocacy to control hypertension. Using a novel approach is also a way to manage hypertension. That is basically, using our knowledge from literatures and based on that, we can help teach the patient and educate the patient on how to manage their hypertension within the primary care setting, and of course in the other setting as well, at home, things like that. I just wanted to touch on this study real brief. I'll mention more on the literature review slide, but there's a study published in 2018 by Dr. Egan and his team. MAP protocol did prove to improve hypertension control within 6 months, and that's roughly a improvement of 10%. So very significant there. On this slide, I wanted to discuss a bit more on the significance to nursing practice, and not just about the provider. I just wanted to be clear on that. The MAP protocol is not just one section of the clinic or the department. It is involved pretty much the entire clinic or system, wherever that is, whether primary care setting, which is where I conducted study, but it involves nursing and the providers and the staff that also um, you know take the blood pressure of the patients, and that's what it stands for. The M, measure accurately. That's nursing, right? And A, act rapidly. Yes, that's mainly the providers, but partner with patient, which is the P of the MAP protocol. Um, that's both. That's providers as well as nursing staff. Not limiting to just the provider themselves. And that's the beauty of this MAP protocol. It's involving the whole team, and the whole team approach working together to help with the patients. These points on my slide is only um, really a few uh, approach that and significant for nursing, but that's what I wanted to stress on this MAP protocol. It's very important for nursing because it's allow the nurses to use this protocol and zooming on uh, these patients with hypertension, and they can focus on them, measure their blood pressure accurately, make sure they're well rested uh, after they sit down in the chair, and then measure the blood pressure. And then again, the P of the protocol is to partner with patient after the patient leaves the clinic. Um, you know, Nursing can also do follow-ups, right? Case manager, which is also a nurse, do follow-ups with patient. Um, and the other important part of hypertension management is education, and that's also involving nursing, right? We have a lot. Nurses have a lot of power and a lot of involvement with this protocol, and that is teaching the patients on the, of course, first, be compliant with the medication, and second, other things such as exercise, diet, you name it. Connect with their communities, and really make sure that we keep a close loop with the patient on how to manage hypertension. Um, uh, that's really the bread and butter of this MAP protocol. And again, it's not only just the providers that involved with this protocol; it's the whole team approach, and it's a standardized checklist on um, you know to help with the patient with hypertension. For example, one of the points on my slide is to help nurses streamline their decision making and come up with a solution that are then follow the standards, and that's what it is, right? It's a protocol that it helps the nurses to kind of like have a guideline, and it's an effective guideline proven to improve hypertension. Healthcare is very complex, and so does managing hypertension. And this is why MAP protocol is very important because it it will benefit um, for the healthcare system. It will improve the patient's experience, and um, it give them the trust to the healthcare system, and a little bit more encouragement for them to access medical assistance. I remember just a little bit of background. We had a mission to Fiji, and I was told that some um, people in Fiji, especially during COVID, were afraid to go to the healthcare system because they just don't trust their um, medical providers there. And it was a military mission, and we were told that we were going to go to Fiji and knock on the doors of those patients that are sick but refuse to go to the hospital. And so you see, that does happen in some part of the world because they just don't trust their medical system or providers. See, we don't want that here, and that's really why the MAP protocol is so important because it's effective as long as we implement it correctly, and it is proven to help reduce hypertension. Um, and this is why the healthcare industry can reach out more to patients and helps expand the reach and reduce um, uh, healthcare disparity. So on this slide, I wanted to touch briefly on the literature review as aspects for this study. Out of hundreds of articles and studies, after the criteria is met, and 11 peer-reviewed articles were um, reviewed for this study. Um, Overall, the review identified study provided a strong foundation for the establishment of this project. Um, of course, there were several similarities and few differences among the 11 studies, but overall, these studies all identified articles of rich in foundation, and it can be utilized to improve screening, diagnose, treatment of hypertension. As I mentioned previously about the study from Dr. Egan and his team, which is one of the significant study that I found, I'm very happy about that. Again, it shows significant improvement in patients' hypertension during his and of course his team study at the time. So very happy to obtain that study. So for the methods of this study, real brief. This is a quantitative exploratory design through retrospective chart review, uh, which is utilized for this project. Um, Participants were selected through convenience sampling, um, and paired t-test was used to determine the statistic significant difference in the mean score from pre and post intervention. Cohen was used to determine if the result was practically significant. On this slide, we're talking about the methods on where the study took place in terms of staffing that's involved with this study. Um, it was took place in the primary care setting of primary clinic that I used to work at in the western region of the United States, Pacific to be exact. Nurses at this clinic were trained on how to use the protocol to manage blood pressure. That is one of the initial plan. Make sure they understand. In fact, that's one of the challenging part of my project, simply because the education as well as talking to the providers and making sure we have the buy-in that they agree to follow and at least give the protocol a chance, and that's is very crucial. And that was one of my initial goals, to make sure that the staff at the clinic are on the same page and will follow the protocol as um, stated on the guideline or on the protocol, and make sure that they agree to follow step by step. Because really, I don't want any bias or skipping or do their own thing, which is would create a error to the data. So that was one of the crucial goal at the beginning of the project. Again, staff were instructed to record the blood pressure on each of the patient, which is 41 patient total in my study, who received the treatment while using the protocol where provider and the nurses applied the protocol. And of course, during this interval, they recorded the blood pressure in the electronic medical records. And with the help of the clinic manager, as well as the staff, that's how I was able to collect the data, uh, given the access for it, and um, record uh, the results of the patients that were seen there during the time that was studied. Um, yeah, so very important. The primary care clinic had 7 nurses, 5 physicians, and 10 medical assistant staff. Um, I just wanted to kind of mention this. This is one of the key resources for this project. Um, is to, you know, these human resources staff to participate in the project along with um, you know front desk secretary as well. Help intake the patient. Equipment is adequate. We had six uh, pretty new blood pressure machines, and very nice to have a medical library as well. Very near the clinic if I need to check on any references during the time that I'm there. Um, uh, Overall, the resources, the staff, and again, like I said, they're very receptive to my plan, and that's very important. So I'm very happy in this part of my implementation um, process and or the period of my study. So for selecting patient for the study, the criteria is pretty straightforward. As showing documentation that the patient is an adult with hypertension between the age of 18 and 65, and they was under the care at the primary care clinic during that time frame, and also documentation that they were seen during the time frame for implementation of the MAP protocol, um, as well as the pre-intervention time frame. And that's basically the criteria for the inclusion of the patients that were selected. Exclusion, basically they are not within the age limit, which is 18 and 65 years old. Of course, they are not under the care at the primary care clinic during that time frame. And lastly, they were not really following the protocol specifically, and for that, they are not included in the sampling for this study. So let's talk about the result um, of my project. It was exciting to find that this project is statistically and practically significant improvement in blood pressure of the patient, 41 patient to be exact, went through this MAP protocol at the primary care clinic that I was conducting the study. Uh, in particular, 23 out of 41 patients recorded their blood pressure drop below 140 over 90 after receiving treatment through the MAP intervention. So that's roughly 56% of the patient that was involved. The rest of the patient, the blood pressure improved, but not both of the um, systolic and diastolic drop below 140 and 140 and 90 respectively. So only 23 out of 41 that actually achieved that, and that's pretty significant. I wanted to take a deeper dive into these results on this slide. Briefly, blue stand for pre-systolic, orange pre-diastolic, gray post-systolic, and orange is post-diastolic. And as you can see, there is a significant improvement in the blood pressure, as I mentioned earlier, on the 23 patients. And I used the grid format on this table so that you can look vertically on the y-axis and the x horizontally, and you can see each patient number from 1 to 41. And by looking up vertically, follow the line, and you can pinpoint out their blood pressure number individually. And then if you look horizontally as a group, you also can see the changes as well on the blood pressure as a group in general. You can compare that as well. So individually, vertically, when you look up in the grid line, and then you look horizontally as a group, and you can compare in that way from pre and post blood pressure improvement. Just want to be more specific. So out of 41 patients, um, there was age, the mean age of the male participant was 51, and while for that female participant was 43. Um, Mean systolic blood pressure was roughly 153, while the mean diastolic blood pressure was 93. Um, and after the implementation of the MAP protocol, the mean systolic blood pressure dropped to 140, while the mean diastolic blood pressure decreased to 84. So it is clear that the MAP protocol is proven to be effective intervention for controlling blood pressure within a primary care setting. Um, I want to discuss a bit on the limitation of this study. And the first limitation is the sample size. As you can see, it's only 41 patients, which is too small. It's too small to able to say that it represents that large group of patients for the adults between the age of 18 to 65. Although it is showing positive result, however, the sample size are quite too small. And the other limitation that I recognize is the effects of time. As you notice, the post-intervention data was recorded during the summer, while the pre-intervention was recorded during the spring. And there was literature that points out that during the summer, our blood pressure tends to be a bit lower. And my suggestion for future studies would be larger sample and a longer period of time that covers not just spring, not just summertime, at least a 12 months period of study, so that we have an adequate sample throughout the year, and that would be a stronger data, and of course also in a multiple clinic and not just one clinic, and uh, I believe that will strengthen the study and the data, and further prove that the MAP protocol is in fact an effective tool that can be um, utilized in every primary care clinic, and to help the patient reduce their blood pressure and improve their quality of life. So that's my study. That's my project. Thank you so much for your support and listening to my presentation.